once, kind of the numbers started to go up on overdoses, and everyone kind of was shook and realized like this is something consuming our city and needs to be addressed.
I think the conversation has been more open and honest, and maybe some decreasing of that stigma that's attached to addiction in general and drug use overall in our community. I think that's also a reflection of how people have been affected by this crisis.
So I think the community has really arced at a good place where everybody is trying different things to ensure that we are a place of triumph.
We've seen collaboration, partnerships form, particularly for areas that the work was being done in our community, but now there's communication. They're sharing resources, ensuring that there's opportunities for learning and growth, which ultimately, at the end of the day, improves the public's health.
We saw law enforcement working with health system, working with our court systems, working with education, working with churches. So we really were a multifaceted kind of approach to how we responded to this.
A large part of our response locally has come from support of policymakers through programs such as the STOP Act, HOPE funds, and other areas that help us plan and develop programs and educate our community on the issues that we're facing today.
Examples are as simple as medication take-back or medication drop-off events where people can drop off or dispose safely of their unused prescription medications that may have very dangerous outcomes if they're used or in the wrong hands or used in the wrong way.
Because of the collective impact we've had over the past couple of years, we've started a few programs in the community that I think are going to have long-lasting impacts, one of those being TIDES, working with mothers who are addicted to substances to ensure that their children are born substance-free.
We had a physician-led prescribing guideline change, and as a result we have 800,000 fewer pills in our community this year just because of the things that they've done.
One of our initiatives at Coastal Horizons, the Quick Response Team, to work with people who are overdose survivors and their friends and family to get them safe, and then from safety get them into care and treatment as needed. And so all of those things I think make for us to have the capacity to be more compassionate and empathetic around this issue.
A more comfortable approach to people like myself being able to say, hey, I'm struggling, because people in the community are stepping out and saying we want to help, and it helps us, but it also helps other people to say, well, maybe these are good people that are just struggling.
We have found more of our residents now even talking within the community about different ways to stay clean, different ways for their peers to engage, NA and AA meetings, where it's really a place of real seriousness amongst our residents, and I would say a place that we hadn't seen in the past.
People ask me frequently, are we out of the woods? Is it over? Are we on the tail end? We're not yet out of the woods, meaning that we really need to be vigilant. Even people in recovery are at high risk of overdose and death because a relapse, even a simple relapse or slip that people might call, could result in something that could be fatal.
We have to keep the momentum that we already have. We've got the support, we're gaining the resources, we have the partnerships. We don't want to lose that.
At every meeting we have, we need to be talking about it. At every conversation outside of the agency with other partners, we have to talk about it. With people that we wouldn't think that it would affect, we got to talk about it.
It's important to keep talking about addiction, to keep talking about substance use disorders, to keep talking about mental health, and continue to advocate for those resources that we need here in our community. This still matters, and we're all a part of the community solution.
We're all part of the community solution.